Good afternoon, everyone. I would like to welcome you to today's webinar with Dr. Maylene Reyes Rodriguez, titled What a Provider Needs to Take into Consideration when Exploring Eating Disorders in the Latino Community. Participants will be muted upon entry and videos turned off. For technical assistance, we ask that you please use the chat box. You'll also receive an email approximately 1 month from today requesting feedback and impact on today's presentation. We also ask that you visit our training center at www.ncdus.org/training to view other training opportunities that we may have. We will also provide slides from today's presentation at the end via email, along with our evaluation if you are unable to take the evaluation at the end of the webinar. We will also have a 10-minute question and answer segment at the end of this webinar. Any unanswered questions will be sent to you via email at the conclusion of 1 week post this webinar. I'll now introduce today's speaker. Dr. Maylene Reyes Rodriguez is a clinical professor at the Center of Excellence of Eating Disorders in the Psychiatry Department at the University of North Carolina at Chapel Hill. She's a fellow of the Academy for Eating Disorders and expert of content for the National Center of Excellence for Eating Disorders, NCED. As a researcher and clinical psychologist, she has devoted her clinical research career to adapt eating disorder treatments for the Latino community in Puerto Rico during her early career and later with her Latin community in the mainland, particularly in Central North Carolina. She has published numerous papers and book chapters on cultural adaptation in order to reduce health disparity and enhancing treatment accessibility. She is actively involved in the Latino community as a columnist in one of the main Latino newspapers in North Carolina, La Noticia, in which she provides psychoeducation on mental health in order to raise the awareness and reduce health disparities. I'll now turn things over to Dr. Maylene Reyes Rodriguez.
Thank you, Lachelle, for that introduction, and thank you, NCED, for organizing this webinar. And thank you, all of you, for joining this webinar. So I'm trying to move the slides. Okay, perfect. So today I'm going to talk about eating disorders in the Latino community, providers' considerations, with the aims to learn about cultural values that are relevant in the interaction with patients from Latino cultural background. Also learn about how you can integrate the personalism, familism in the initial identification and assessment of eating disorder in the Latino community, and discuss what practices are more congruent with the Latino community during the intervention. So it's my intention during this webinar to talk about first about the debates about the terms of Hispanic, Latino, Latinx. I also wanted to start talking about how we can approach reduce the stigma, which is one of the main issues when we are working with the Latino community. And also I wanted to talk about the different cultural values that I found that has been very important when we are interacting with the Latino community: familism, personalism, respect, and also how you can integrate those cultural values in the interaction when you are working with Latino community. So first, I wanted to spend some time talking about the debate about the terms, because we have heard about the use of Hispanic, Latino, Latina, more recently Latinx, Latin, and sometimes it's confusing. It's confusing about which is the correct term that we can use to refer to our community. So it's not my intention to tell you which is the correct one. I think that I just wanted to provide some kind of context about each of the term. And I think that based on that, you can make a decision about which one do you think that could be more appropriate. When we talk about Hispanic, first, this is the first term that the US Census used to refer to ethnicity, and is more based in terms of the language. For those countries that have Spanish as a first language. So that not only include countries from Latin America, but also Spain. But also there is some kind of connotation about colonialism. So in that sense, when we think about Hispanic, especially for those who are from Latin America, doesn't feel good to be part of a name that in some way represent the colonialism. When we then introduce the term Latino, Latina, it's more about those who are located in Latin America. So that include, for example, Brazil, that they don't speak Spanish, but they share some cultural background similar to people who are from Latin American country and only speak Spanish. More recently, we are seeing the use of Latinx and Latin. And the intention to use that term is to be more inclusive in terms of the language, be more gender neutral. However, if we look into the survey conducted by the Pew Research Center, we are seeing that this was in 2019, the use of Latinx is only recognized by 3%, maybe now is about 4%. So the reality is that the community doesn't feel related with the term Latinx, Latin, and we have an issue, right? Because if we wanted to be inclusive, there is a problem if you are using a term when the majority of that community doesn't feel that related with that term. So I think that it is important to think about how we can be inclusive in terms of the language, but also using a language that in some way don't exclude members of the community. In English and also in Spanish, there is many other ways that we can be inclusive. For example, when I mention the Latino community, I am referring to the community. I'm not talking about she or he. So it could be gender neutral. There is other suggestion that recently I saw about using Latin and asterisk as a way to, you can put in that asterisk whatever you wanted to put. So I think that this is something that is evolving, and maybe 10 years later, we can have a different kind of conversation about the term. I think that if you have someone from Spain, maybe that person will feel more related with Hispanic. If you are talking about people who are from Latin America, they will feel more related with Latino or Latina. Or if they feel more that they wanted to be in a neutral, gender neutral, they feel more comfortable with Latinx, Latin. Also, I think that it's important to recognize the nuances by subgroups. I think that there is a tendency to have this umbrella when we talk about the Latino community, but we forget that we are different in many ways. Even when we share similar cultural background, we have some differences, and it is important also to recognize. So in that sense, usually I recommend that not only collect the ethnicity, but also ask the country of origin of that person. So in that sense can give you an idea about differences, for example, from Cuba, Puerto Rico, Mexico, Guatemala, El Salvador. And there is other kind of history and political situation that can also give you some context about that person. The other piece that I think that is very important to tackle from the beginning is reducing the stigma. it is well documented that the stigma about mental health is a big issue in the Latino community. Having a mental health is something that is very negative in many ways. Is negative because it's in some way a sign of weakness. It's like not trying enough. It's like a wrongdoing or a sin that can be passed from one generation to another generation. And when you look into that way, it feels heavy, and it's heavy. The other piece that I found, in addition to the stigma of mental health, is that when we have a patient who is struggling with eating disorder, the stigma of having an eating disorder usually is greater than the stigma of having a mental health. And what that means that you can have a patient who is willing to share his or her struggle with depression and anxiety, but not necessarily share the struggle with an eating disorder. So why it is important? Why it is important to tackle the stigma from the beginning? Because prevent Latino community to seek professional help. I don't want to have someone see me going to a mental health clinic. I don't want my family to think that I am crazy, that I am loco, which is a term which has a very negative connotation in the Latino culture. So it is very hard to engage the Latino or Latina into treatment because of the stigma, but also contribute to early dropout. Sometimes going to the first sessions, 2 sessions, and then just drop out from treatment because they don't want it to continue in a treatment that in some way is saying that she or he has a struggle with a mental health condition. Also, that contribute to fatalism, which is something that is very common in the Latino culture. Is the sense that no matter what, I will be living in this situation. There is no way that I can feel better. And that also can affect not only the engagement in treatment, but also keeping them in treatment and to feel better or to try different aspects that we can suggest in treatment because of the fatalism. But also it's a cause of a lot of pain and suffering. So I think that tackling the stigma from the beginning would be very important in order to have them on board with not only the diagnosis, but also with the treatment process. So how we can do that? And another topic that I wanted to mention is the weight, because the weight stigma is something that we are seeing more and more recently. That is related with sometimes the physicians telling the participant or the patients about their weight without any kind of context. And you have to lose weight. You have to engage in diet behavior because you have to lose weight. And that is raising a lot of stigma about their weight. So not only we have now the mental health, which has been historically an issue, we have the eating disorder stigma, but also now we are seeing more and more patients struggling, especially younger patients struggling with the weight stigma because of the fat phobia, because all of these dieting culture that we are seeing in the medicine, in primary care physicians, that in some way are raising some kind of a stigma about weight. So what we can do to tackle that, I think that the way that we need to start working with the stigma is with education, is psychoeducation. Part of the process when we have a stigma is we don't talk about the situation. We don't talk because it's shameful. So one of the ways that we can start working with the stigma is educating, is talking about the situation, is talking about the mental health symptom, is talking about the eating disorder. And by educating, we can reduce the stigma about having an eating disorder, and that will help you to explore the eating disorder. So it's like a process. Sometimes when we are doing like an assessment, we just want it right away to start like exploring the symptoms. And sometimes the patient is not ready to do that because we need to do like an education before in order to open up the process for the exploration. I don't know if you are familiar with the movie Encanto, but I think that movie nicely represents the stigma about a mental health disorder in the Latino culture. Is we don't talk about Bruno, right? We don't talk about that person who is struggling with a mental health disorder or something weird. Everybody knows that there is a family member struggling, but we don't talk about it. So I think that nicely represents all of the process in the family and how the family is affected by the stigma, and how can prevent them to seek professional help. The other piece that I think that is important when we are talking about education is a process. It's not like just giving information. It's integrated as part of the relationship. And I will talk more about the relationship in a bit. So what are the cultural values that are very important, very pertinent to talk related with the Latino community? There's these three. There's many others cultural values, but I think that these three are very key when we are interacting with the Latino community. The first one, I think that most people are very familiar with, is familism. Is how important is the family for the Latino culture, and is the sense of closeness, is the boundaries. And something that is very important is to be aware that maybe the boundaries will be different from the American culture. We talk about the immersion, that I know that for American, immersion is something that is not necessarily positive. However, in the Latino culture, when we talk about immersion, it's something that is positive. It's meaning that there is the sense of closeness. And also, we have to recognize that family, not only we are talking about the immediate family, but also the extended family. Extended family could be uncle, aunts, could be grandparents, could be godparents, could be neighbors. So it's extended family. And power dynamic also is something that we can see in the family, that we see that usually is affected when they move from their country to the United States. And I will talk about how we as a provider can affect in a positive or in a negative way in terms of the power dynamic in the family. The other cultural value that is important is personalism, is the importance of the relationship. And sometimes people think that it's an easy process, but not. Take a lot of time, take a lot of effort. It's the sense that you care about them, that they feel that really you have a good intention, that you are listening. And everything is embedded into the relationship. So if we are going to do psychoeducation, trying to do it outside of that relationship is very hard. The other cultural value that is important is respect, especially in the context of providers. Respect is the acknowledge that there is a social authority. in this case, in the Latino culture, the physician, the therapist, the doctor, they are the authority and they are listen to what we have to say. So in that sense, we are powerful and we have to be very careful how we use that kind of power. For example, sometimes we have some dynamic when we have provider who doesn't have any eating disorder background saying something different from people or provider with a expertise on eating disorder. That create a sense of confusion because they don't know who to respect. Should I respect my physician who is saying that I am ready to do exercise, or do I have to follow my dietitian, my psychologist, who is saying that I'm not ready to do exercise? And that create like a lot of chaos in the family and with the patient, because we are affecting or using the respect in a way that can be very confusing for the patient. Also, we have the family authority, and this is something that is very different depending on the country of origin. You can see, for example, especially patients from Central America, that the way that they interact with parents are very different from, for example, I can speak for my country, Puerto Rico. Usually we have a different way in Spanish to refer to you. You, in English, is just you. In Spanish, we have tú, which is very informal. It's saying that we are in the same level. And then we have usted, which is showing some kind of respect, that I know that you are above of me in terms of the hierarchy process. So for example, as a provider, if I have a parent who is older than me, usually the way in which I approach that person is using usted. It's showing that I have respect because they are older than me. So there is some kind of rules that we use in terms of being respectful in the Latino culture. And we are seeing in some family from Central America that kids talk to their parents in that kind of respectful way, is using usted, which is very different, for example, from my experience, where parents, we are basically, yes, they are the authority, but there is some kind of way that we can treat more informal that we can use too. So there is some kind of dynamic that also is very important to be aware how this family interact and how we can, as a provider, can respect that dynamic. So let's talk about familism, how we can include this value in an initial assessment. That means that it would be important to include parents if we are working with minors. And that is something that could be common sense, but usually sometimes providers, because of the language barrier, they are not including parents in the intervention when they are working with minors. And that is something that is affecting the dynamic with the patient, with parents, and eventually you will see that recommendations that you are doing as a provider can be affected if you are not including parents in the process. If you are working with an adult, it's not that by default you have to include a family member, but you can explore if the patient want to have, for example, a partner or someone from the family as part of the process, because sometimes they prefer to have someone to provide support. Usually having a family member as part of the treatment process, I found that could be something that can encourage the patient to seek professional help and to keep them into the treatment. It's like a motivator for them. It is important as part of familism to explore the family and cultural dynamic around food. I think that not everything is about the eating disorder. I think that it is important to explore what is related with the culture. For example, we have patients who are from different Latin American countries that they have a different kind of schedule for their meals. And we have to just explore what is the cultural background and then respect that and see how we can integrate that into the treatment without trying to change the family dynamic in terms of the family meals or the timing of the meals. The other piece that is important is exploring the acculturation or the acculturative stress. The acculturation is the process of adapting to this new culture. And then the acculturative stress is all of the stress coming from the process. And we know that the acculturation per se, that is not necessarily a risk factor for eating disorder, but if we have a patient with acculturative stress plus body dissatisfaction, that could lead to an eating disorder. So this is why it is important to explore that. And there is some measures that you can use to assess the acculturative stress. Personalism is another process that it is important to include from the beginning. And this could be very different from American culture. What is important when we are exploring the personalism is the active listening to the story. Usually in the Latino culture, we wanted to tell the story. We wanted to tell you not only about what are my symptoms, but also I wanted to tell you the context of my symptoms, because that means that you care about me as a person, not only as a body that is like having some specific symptoms. So having this active listening would be important. It's showing that you care, and also sometimes it's going beyond the role. Just to give you an example, we refer this Latina patient, adolescent, to the psychiatric clinic due to anxiety. And she had a pretty bad experience with medication, side effects. And when the psychiatry resident saw her, recommended some medication and say, okay, I want you to try this medication and give her like a follow-up appointment. I can remember 3 weeks or something like that. And the patient started taking the medication, and the resident called the patient 1 week after that, just to explore how she was managing the medication. And I remember the patient coming to my session for treatment, and she was like very impressed, saying, this resident called me. She called me 1 week later to see how I was doing. That is showing that she cared about me. And maybe that was like a simple call for that psychiatry resident, but for that patient was a lot. Was to show that you care about me. And that is the piece that I am saying, that sometimes with the Latino culture, you have to go beyond the role. Another example, I have a patient who I did an evaluation, and I identify that the family was struggling because of many different factors. And I decided after finish the assessment to start looking for food banks, other resources at the community. And at the end of the evaluation, I sat with mom and I explained all of the resources, and I explore a little bit more about other needs based on the situation. So in that sense, it's showing that I care about you. It's not only about a transaction, that I am here to do an evaluation, I get the information and I am done. It's more than that. It's creating this connection, this relationship that make them feel that you care. And that is the piece that eventually will help them to feel comfortable with you, to listen to you, to open up to you, and to follow through whatever recommendation you are doing. Respect. Respect is a value that I think that is very important to bring, especially when we are working in the interaction with especially physician and also therapist. For Latino culture, the physician, what they call doctor, usually they call doctor everybody that is a provider, is an authority. And because of that, they don't want to be disrespectful by asking questions or saying, I don't feel comfortable with what you are saying or what you are recommending. So it is important to create an environment that you can promote questions and answers for them. It's something that we have been educating the community. I do that through my column at La Noticia in podcast, because they don't feel comfortable asking questions to physicians. And most of the time, they don't follow through the recommendation. They don't follow through the treatment process because they are afraid to ask, because they don't want to be disrespectful. So if you as a provider, you are prescribing a medication and the patient is afraid of creating an addiction of that medication, but the patient doesn't feel comfortable asking you or saying, I don't feel comfortable with that medication, then we have a problem. So this is why it is important to work with a space that the patient feel comfortable asking the question. And I usually encourage and advocate for them. You can say, you can ask questions. They are there to provide that education to you. The other piece would be important is to respect the family hierarchy. By doing that is, as I said from the beginning, we have to include parents in the process. I think that alienating them because they don't speak English, you are affecting the family structure. You are taking away the power from parents, and eventually they will not be in a position to enforce the recommendation that you as a provider are recommending. So this is why it is important to, as provider, respect that family hierarchy. So I wanted to navigate through different cases and trying to identify how we can incorporate the family values and cultural values in general through the cases. So the first case that I have is an adolescent. Elena comes to your office with her 14-year-old daughter, Sophia, due to concerns about significant weight loss during the past year and engaging in dieting behavior. Sophia doesn't want to eat mother's food because it's too greasy. I think that the first step is asking if mom wants or she needs an interpreter. And I know that the use of interpreter could be, has like pros and cons. I know that if you are in a private practice, maybe you don't have the access to interpreter. So in that sense, you have to maybe explore. This is something that I feel comfortable to treat a patient that the family, I would need to work with the family. Sometime I remember a case where provider from the community was working with an adult, 20 years something, and she, in some point, she realized that having mom involved in the process was very important. And she asked me to do some sessions with the family, and that provider continued working with the patient. So also you can identify someone at the community who is bilingual, who can provide you some support if it is appropriate. But I think that if you are working in a hospital or a place where can provide interpreter, that could be the option to go. Pros and cons. Not all of the interpreter will translate accurately. Sometimes also they can add more recommendation that the recommendation that you are actually saying. They usually can create a relationship outside of the office and give them other kind of recommendation outside of the interaction in your office. So there is pros and cons. If you're using interpreter from a hospital, they have rules. You can file a complaint if something is not going to the right direction with an interpreter. But is better than alienating the parents because they don't speak English. Listen to the story and explain your intervention. I think that, as I said, when we are listening to the story, we are saying, I care. I wanted to know exactly what is going on. It would take a little bit more time. It's not like 1, 2, 3, just let me know what are the symptoms. Take a little bit of time to listen to the story. And also it is important to explain your intervention. And I will give you some context about that. Sometimes I have patients for an evaluation coming to my office that is in a hospital, and because the physician or whoever did the refer, they didn't explain to them about what is an evaluation. Maybe the provider, they don't know exactly what entails the evaluation. But sometimes parents and patients, they come to my office scared because they think that they will stay at the hospital that day. So I think that something that I do from the beginning is explaining, this is what I will do today. This is an evaluation. Usually when I am working with minors, I sit with parents first, then I sit with the minor, and then at the end, I bring mom and or dad and trying to explain, give like a summary about the evaluation. So, and I explain from the beginning to parents and patients what is going to happen, and explain that they are not, that the patient will not stay at the hospital that day of the evaluation. The other example that I can give you, just to give you a context about how important it is to explain the intervention. I heard from a provider from another mental health clinics providing services to the Latino community. This provider was like giving the appointment for treatment process, and the person was like silent, a little bit awkward, and the provider, just explain, I am giving you the appointment for the treatment. And the patient asked, when is the surgery? So in that moment, the provider realized, oh my God, this person doesn't understand what is a treatment, what is the appointment for treatment, and I have to explain in simple words what is going to happen. So the person in his mind, he was thinking about a surgery. So sometimes we are very familiar with the terms that we use: evaluation, assessment, treatment process. And sometimes we don't think that a person that maybe is the first time coming to your office, they haven't heard that kind of language. And we have to explain in order for them to feel more comfortable with the process. So then explore what they know about eating disorder and provide a psychoeducation. Remember that we need to create the environment in order for them to feel comfortable, open up about the eating disorder. So it is important to explore what they know and then explain to them what is an eating disorder. And then after doing that, we've been important to explore the family dynamic around food and food insecurity. I think that food insecurity is something that we have to explore by default. I think that it's important to explore the family dynamic too, because we wanted to separate dynamic that are more related with the cultural background, with the family dynamic, rather than from the eating disorder. So by doing that, we are working on personalism. When we are listening to the story, we are explaining the intervention. We are asking if she needs or wants an interpreter. We are working with the stigma when we are providing a psychoeducation. And we are also including parents as part of the process where we are working with the familism. So here is another case. We have Jose, is a 48-year-old Latino who was diagnosed with diabetes. His wife reported that he's eating more than usual. He got upset when wife brought this up. So how we can start? We need to explore if Jose wants to have his wife during the assessment and if he wants an interpreter. Explore the possibility of an eating disorder and provide psychoeducation. Carefully explore lack of control. This is something that in Latino males I found very important, because for some males, Latino males, depending on the country, lack of control could mean aggressive behavior. So if you are exploring binge eating episodes and you are saying with the sense of lack of control, they will tell you, no, I don't have that. So you have to explore the lack of control in a different way. It is hard to stop eating when you start eating. So there is other ways that you can explore the lack of control, but remember that for Latino males, it could be confusing when you use the lack of control. And explore if why can be a support system. Again, it's not for granted that or by default that they will want to have a family member as a support. Usually in my experience, most of the time they want to have someone with them. But I usually ask first because I don't want to assume that this is the case. The other piece that I think that is very important in the line of careful explore lack of control is the translation of binge eating. I think that as a provider, it would be important if we are seeing patients from the Latino community to be familiar with some words in Spanish, especially related with eating disorder. Binge eating is a term that has been very difficult to translate into Spanish. The official word that is in the DSM-5 in Spanish is atracón. That word we decided as member of the Latin American chapter of the Academy for Eating Disorder, that was the most appropriate for most of the Latin American countries. However, for example, when I did the adaptation in Puerto Rico, the word atracón was so casual, and a lot of people use atracón when they overeat because of festivity, and was not necessarily capturing pretty well the clinical aspect of a binge eating. So sometimes it is important to be more familiar with the terms in Spanish. Something that also I found that some interpreters, they are not familiar with the eating disorder terms, and it's very difficult sometimes with them to translate accurately because they are not familiar with the eating disorder term. So it would be good for you to have like a different, especially the binges. I think that is the more controversial term, which are the words that we use, which is atracón. In Puerto Rico, we use ingesta voraz as a way to separate the difference between a casual atracón or a binge versus a clinical binge eating. So personalism, you integrate that when you ask if he wants to have a support system, when you are asking about the interpreter. You work with the stigma when you are providing the psychoeducation. And also you work with the familism when you ask if she wants to have the wife as a support system. Here's another case, Maria, 25-year-old bilingual Latina who has postpartum depression. She reports having some eating problems but didn't specify. So establish the connection by actively listening. Provide psychoeducation about eating disorder because we wanted to tackle the stigma. If you don't ask, you are contributing to the stigma. Assess the possibility of an eating disorder. Explore support system and health insurance. That is something that is important to explore what resources they have, not assuming that they have health insurance and they can afford all of the treatment that you are recommending. And help the patient to identify resources. With that, you are working on personalism. I care about you. I wanted to help you to identify the resources. By education, you work with the stigma, and familism when you explore if they wanted to have someone, a family member into the treatment. So what are the congruent practice in the Latino culture? Identify the level of acculturation and the need for interpreter services. That is the key. Respect the family hierarchy by acknowledging parents as authority. Explore how and when it is relevant to include a family member during the intervention. And when working with minors, always include parents in the intervention. It's sad when parents mention about not being part of the process because of the language. Provide psychoeducation about mental health and eating disorder in order to tackle the stigma. And remember, establishing a relationship that promotes connection. Without the relationship, it's very hard to establish the connection and to have them on board with treatment process. So here are some resources in Spanish from NIDA, National Eating Disorder Association. Also, NIMH has some information in Spanish that will help you to have some familiarity with the terms in Spanish. SAMHSA also have some information in Spanish. FEAST, the Center of Excellence for Eating Disorder at UNC and NC also has some information in Spanish. And the other resource in Spanish is the medical guidelines from the Academy for Eating Disorder. They have the guidelines in many languages. Spanish is one of them. This is not the latest edition. We are now in the fourth, so usually we are behind one edition. So this is the third that is in Spanish, but I think that as a provider, if you are working with members of the Latino community, it is important to have guidelines in Spanish so you can also help the patient to understand your recommendations. And here are some reference. The first one I discuss about familizations, the context of familizations that I conducted as part of the cognitive behavior adaptation for binge eating and bulimia. And the second is a case study, was the first case that I treated here for bulimia nervosa using cognitive behavior therapy adapted using a family member, and illustrate all of the cultural values and how it was integrated into the treatment process. So I think that we are ready now for some questions.
Thank you so much, Dr. Maylin Reyes Rodriguez, for your information and for the session today. As a reminder, I would let you all know that we will be sending these slides out immediately after the webinar. And we will also be going into our Q&A session. 2 weeks from today, we will have this webinar available on the NC Training Center. I'll now go into our question and answer segment. The first question reads, thank you for addressing the issue of the term Latinx. I think cultural humility dictates that we address people in terms they prefer. So actually that's a comment, so I apologize. The next question is, should we ask our clients if they prefer tú or usted?
Yes, I think that the way in which usually works in the culture is that if you don't have that close relationship, you usually start with usted, because it's showing the respect to the other person, even if it is, usually if it is a person older than you, you have to start with usted. If it is a minor, usually usted could be like establishing some kind of distance, so we have to be careful. Usually when you are working with a minor, too is fine. But also if you feel that you are not sure and you wanted to ask, maybe my guess would be that for some of them would be irrelevant if you use to usted. But usually if you are treating or seeing an adult that is older than you, you can start with usted.
Thank you so much for your response, Dr. Reyes Rodriguez. The next question reads, what is the literal translation for familism? Is it familiaridad?
Familismo. Familismo is the Spanish word for familism.
Thank you so much. The next question reads, what was the name of your podcast?
No, it's not the podcast that I have. It's a podcast that I did with a professor from UNC in Charlotte. Was interesting because he suffered from mental health disorder, and the podcast is a journey. It's a journey through health with mental health conditions, El infierno de las enfermedades mentales. It's a very interesting podcast. I did an episode where we talk about mental health in general, because we wanted to raise the awareness and tackling the stigma by talking about the topic. And he suffered from mental health, and he's very open about that. And he invites people from the community talking about their mental struggle. So it's journey through health with mental health conditions. and he is from UNC Charlotte.
Thank you so much, Dr. Reyes Rodriguez. The next question reads, what would you recommend if the family has a history of trauma and the patient has challenges with communicating with family? Would you still try to involve parents in the treatment for the patient?
That is a good question, and thanks for bringing that up. Yes, it is important to assess if there is some kind of trauma history, and obviously if the minor is expressing some concern about having some specific family member into the process, the treatment, because of the trauma, any kind of abuse. Obviously, we don't want to involve that family member into the treatment process. We wanted to protect the child. So part of the process that usually as part of the evaluation is assessing trauma piece. And it is important to ask. Sometimes we are afraid to ask. It's important to ask. And even if we have some kind of concern about any family member, it is important to double check in order to be sure that the patient is safe at home. But if there is some potential history of trauma with some specific family member, I don't recommend to add that person into the treatment process.
Thank you so much for that response, Dr. Reyes Rodriguez. The next question asks, is it all right to ask the client what they would like to be called if you are not Spanish speaking?
Yeah, that could be a good way to go. The same way that we ask about in terms of pronouns, we can ask what you prefer in terms of Hispanic, Latino, Latina, Latinx, Latin. I think that it's fair to ask if we don't know what is more appropriate.
Thank you so much, Dr. Reyes Rodriguez. The next question reads, and they're also providing you with a compliment. Thank you, great session, Dr. Reyes. Do you believe the seeking attention is raising in the Latino community?
I don't think that necessarily this is unique from the Latino culture. I know that maybe we express our feelings, emotion in a different way. We are a little bit more dramatic, I will say, but not necessarily is seeking attention issue. So I think that I don't like to generalize and say that this is something that happened in our culture. I think that can happen the same way that happened maybe in for American patients. So I think that in that sense, I haven't seen like it's unique for us, but maybe we can express feelings, emotions in a different way that could call the attention.
Thank you so much, Dr. Reyes Rodriguez. The next question asks, is there food alternatives that you recommend as psychoeducation if there are cultural differences in the types of foods that are typical and tend to be more fatty or greasy?
I think that food is food and it's good. I think that we have to be sensitive to the cultural background of the patient. Part of the process of the acculturation is that sometimes minors, they start like, as part of the acculturation process, they wanted to eat more American food and they are more reluctant to eat traditional food. But also I have other Latino patients that they are more into traditional food and they don't like, for example, the food at school because they don't like it. I think that we have part of the process of the assessment is exploring the dynamic around the food, preference, and I think that it's not about mentioning this food is fatty than other. No, food is food. I think that is creating the balance Food also is connecting you with your culture, which is something that for many patients is healing. So I think that it's just recommending like a balanced meals, regular eating patterns, as the same way that we do with non-Latino patients.
Thank you so much for that response. The next question reads, any tips or resources for working with clients that experience food insecurity?
Yeah, for food insecurity, I think that is important. Also to explore the context, right? The context in terms of history of food insecurity that can happen because of the country of origin. I have access to that with people from Cuba or people crossing the border and experiencing food insecurity. I think that is important to assess their experience for food insecurity before, and also in the present, if they are experiencing with food insecurity, is searching at the community. There are information at the community about food banks. There are Center for Hispanic available also that can be resources. I think that is connecting the patient with the community because there's some support there, and that is the best way to help them to connect with the community.
Thank you so much for that response. And then we move into the last question, and I think you shared this earlier, but if you can reshare it again. Someone asks, where can they hear the podcast? If you mention that, if you don't mind mentioning that again.
Yeah, and I can give you the information, so we can send the information to everybody. This is the Journey Through Health, but I can send you the link to that podcast, because I think that is a good resource to hear about the stories of patients, and it's a good resource for the community and for you as a provider.
Thank you so much. So once again, we'll be sure to include that information from Dr. Reyes-Rodriguez in the email that goes out to you after with the webinar slides, and we ask that you complete our evaluation that will also be included in that email. Thank you once again for attending today's presentation. And we thank you, Dr. Reyes-Rodriguez, for your time and your level of expertise and the wonderful information that was shared today. Thank you all.
Thank you.